Hello, my friends. It's all about the angles. There we go. We have somebody very special on the table today. I think we started doing the Flux with Friends last year around September. And that was with a yoga pelvic floor therapist, but a yoga therapist. And one of the most important things that she said on there was that you really need to see a yoga floor physical therapist because they're going to be able to do all the tests that you need to see what's going on, what's working, what's not. And almost a year later, we have a real one on the table with us. So can you tell us a little bit more about, that's what the yoga therapist said. She said that we needed to meet somebody like you. What would that an experience be like as like a new patient?
Yeah, so pelvic floor physical therapy is a specialty in physical therapy. It isn't anything that you learn while you're really in physical therapy school. So you go back after school to gain the education. But basically, as a pelvic floor physical therapist, as long as the patient consents, we truly assess the pelvic floor. And the only way to assess the pelvic floor is to do an internal transvaginal or transrectal examination. So that's why patient consent is critical. There are some ways you can assess the pelvic floor externally, but the gold standard is an internal pelvic floor assessment.
And then, I know that my sister, when she was working on getting pregnant and stuff, she was recommended to go to a pelvic floor therapist. But then, our yoga therapist that was in, I was shocked to hear that I was just thinking it was a woman's thing, I guess. That's the only ones I've heard, and I have mostly women clients. But she said it can help guys, like, as they age, with, like, anything from, like, fertility to bowel movements to, obviously peeing.
Yeah, a sexual dysfunction, you name it. A lot of men have, especially, we see a lot of men who are business owners or very high profile clients who have like penile pain or testicular pain or hip and groin pain that can contribute to pelvic dysfunction. So it's a lot more common, and that's probably the one area that men are underserved. Is men often get misdiagnosed with prostatitis, and then they're put on tons of antibiotics, which then messes their gut health all up. When really, in all actuality, it's not prostatitis; it's actually pelvic floor dysfunction.
That's amazing.
Mm-hmm.
So, and then you also give them like exercises to do. So it's like a bit of manual manipulation as well as exercises.
Yeah, so there is in our practice a lot of manual based physical therapy, and that can be lots of things, right? It can be myofascial release, visceral, which is organ mobilization. There's just a lot of different things we do, and it's very patient specific. We do exercise. A lot of people think of pelvic physical therapy, they think of Kegels, and I always say if Kegels worked, everyone would do them and no one would forget them. It is so much more than Kegels, for sure.
I like to do my Kegels sitting on the vibration plate.
That's awesome.
And then I try to do like one butt cheek on and then hanging off and then one butt cheek off.
It's good.
And then I do a lot of bridges.
Uh-huh.
Because a lot of times, like, you can't really get those, we do body sculpting here, but you're not going to get those lower abs showing if you don't have a strong inner core, pelvic floor, all of those things.
Yeah, talking about that, so many women and men, they don't even know where their deepest abdominal muscle, their transverse abdominis, they don't know where it's at and how to contract it. And so a lot of people are doing tons and tons of crunches, leg lowers, all the things, and then they're ending up with a lower belly pooch. And the transverse abdominis is one of the inner core muscles that should work synergistically with your pelvic floor. And that's what gives you a flat little tummy. And so if you don't know how to engage that correctly and you're over-engaging your obliques, you'll have a lower belly pooch.
Yeah, it's like you can build it out.
Yeah, and so there's a lot of people who come in and they're like, I can't get rid of this pooch.
And a lot of people, you know, even if you're, that's the same thing why we have a lot of videos with personal trainers as well, because you can watch something online and you might look like you're doing that, but if you're not engaging the right muscles in the right order and all of that kind of stuff, then you're not doing it right. You're not.
That's exactly right. And, you know, one of the biggest things as pelvic physical therapists we really look at is pressure management. So many people are not managing pressure as well. And a lot of times you can't tell that by looking at somebody. So that's where an internal pelvic floor assessment is really important, because you can feel the pressures kind of coming down. And so it helps if you can teach people how to control those pressures. It helps with so many things: preventing leaking, preventing prolapse, preventing pain, lots of things, but it also helps with appearance.
Yeah, well, another thing that our yoga therapist, pelvic floor therapist, was saying was that you kind of really want everything to be in balance. You don't want something to be too tight or too loose. Both
That's
of those
right.
things can be bad. Can you tell us more about that, both for men and for women?
Yeah, so I mean, just like anything, if you've got one area that's too tight, you're going to have another area that's compensating, and vice versa. And so that's why, you know, a lot of times when people think of pelvic floor physical therapy, I always say if you go to a pelvic floor physical therapist, and now there are occupational therapists that do pelvic floor. If you go to a therapist and they're just evaluating you laying on a treatment table, and they're not evaluating you in the positions in which you're having troubles, it's really, really difficult to fix the issues, because it's a whole body issue. It's not just a pelvic floor issue. And so you always have to think about the compensations, and you have to look for the compensations to get that right balance back.
I've definitely experienced that with physical therapy with my own body and, you know, working on my joints and stuff, having broken a lot of bones and how that twists your fascia, or sitting for long periods being active, how that twists your fascia. It was my second solid core class ever, but I did something called Pellegrini or some other kind of, it's like Pilates, but extreme core.
Okay.
All 3 times I've done it, I'm like, oh my gosh. Luckily, the first time I did it, I was in Miami, so I was like walking back home, but I was like in a daze. The last 2 times I've done it here, I'm like, I just need to sit in the car. Like, I'm not okay to drive. I need to go eat something. But what I really loved about it was there was a lot of parts that I did really good, but then it would kind of tell on you like exactly where you were not training. I was like, oh, okay, we've got some crunchy toxins in these hips, in this left elbow. So then I know where to go, like, bring that up to, you know, my physical therapist. Hey, this part's messed up. What can we do? And a lot of times, like, sometimes your, like, wrist is not in the same right movement, right? If you keep training that way
Right.
with somebody, then you're going to get really strong doing it the wrong way.
That's exactly right. I always tell people it's really more about neuromuscular re-education and retraining the brain, and getting back in contact with the right muscles, and then coordinating those.
Yeah, coordination. That's where I'm a little slow.
So are a lot of people, and that's okay.
I've got the ADHD. I'm like, huh? Takes me a minute to like get it. Then once it's locked, it's locked. But simple things can be slow for me to learn.
No, and that's okay. Like we see a lot of clients at our practice who are like F45ers or CrossFitters or Orange Theory people, and you know, a lot of times it's about breaking down the movements to allow their brain to learn a new
yes,
motor
absolutely.
pattern,
Yes.
to then put the whole movement pattern together.
Yes.
Yeah.
And once it's in there, it's like code.
That's right.
Code is in,
That's
and now
right.
we got it. Now it's locked in.
Yeah, you know, the crazy thing though is when people get tired or they're fatigued, your brain will want to go back to that old pattern because it remembers it. So it takes a lot of practice at first.
Yeah, we were doing a live stream with Amber from D1 Fitness down the street, and she had me doing these skipping things. And one I was like, oh, I was all right at. The next one I was like, I have no idea what you're doing. She's like, there's one more. She's like, this is the hardest one. And I did it like perfection, like a ballet dance. I was like, I think I did that in martial arts or something before, because that one was like the easiest one.
Good for you.
It's definitely like that, you know, getting it locked into the brain for sure.
Yes. That's what you want. The whole goal, a lot of people think, pelvic PT is just, like I said, all about Kegels and it's doing all those things, but it's not. It's actually teaching that inner core to become anticipatory again. So that's the whole goal of pelvic physical therapy, is breaking the movements down, then getting all 4 of those inner core muscles to work together, and then teaching them to be anticipatory.
Now, are there any things that can make, besides, learning it wrong or practicing it wrong, that can cause like misfires of the muscle when they were trying to work together and maybe they're working at the same time instead of working, step 1, step 2, step 3?
Well, I mean, honestly, with anything, there's actually some studies out there that show that our muscles can just misfire. You could be doing everything right.
Oh, okay.
And they did a really cool study on professional bodybuilders that just lift massive amounts of weight, and they were trying to figure out why some of them hurt their back. And what they found in the study was just sometimes our muscles just misfire.
Oh, okay.
Right?
Especially if they're using them a lot.
Exactly. Yeah. But other times, if muscles are misfiring, it's just a learned pattern somewhere along the way, or something that has happened to cause those patterns.
Yeah, it's so
It's
interesting.
all retrainable, though.
Yeah, I love that. One of my favorite books ever is The Brain That Retrains Itself, and really so much of the body can do that too. I had a skin reaction to some cheap jewelry and went deep down the rabbit hole of your skin has PTSD and you have to retrain your skin out of that PTSD to stop having a trauma response. Otherwise, I could touch cheap jewelry again with my finger and it'll show back up on my forehead. And I was I knew when I was going through that, I was okay, I'm learning this because some clients are now I've had 4 or 5 clients that went through the same thing. I was I gotcha. I've learned the wrong way and the right way. But our muscles are like that. Our brain is like that when we're creating new habits. So, and then you have 3 locations, right?
Yeah.
And where is the first one?
So the first one, my husband and I lived down in the Center Grove area for years. So my first location was down in Center Grove. Now, I will say, I'm almost 30 years out. And so in the state of Indiana, you really couldn't open your own practice until we got direct access, which was in 2013.
Oh, wow.
I mean, you could, but you had to be affiliated with doctors, because before 2013, we had to have a doctor's order to see patients. Now, since 2013, we can see a patient without a doctor's order. That's for amazing. 42 calendar days. So I opened my first practice in 2016 in Greenwood. And then,
what is for 42 calendar days?
Just means that after 42 days, you do have to have a referral from an approved provider to continue
so one
care.
Person can see you for 42
That's
days.
Right. Yep.
Oh, awesome.
Yep. And we typically don't have a problem getting an order to continue therapy, which is great. I started.
Now, what if somebody doesn't have insurance? Can they just come pay you?
Yeah, and we are a boutique cash-based service, so we do not. I purposely went out of network in 2016 because we were being severely limited.
Yeah.
On what we could do with patients, and with insurance, you can't treat the whole body, and you really do need to treat the whole body in order to help people get better. And what I was finding is it was so incredibly expensive for my patients. We were verifying insurance, and patients were being told that the service would be covered. And unfortunately, the way it works, you see a patient usually for 4 weeks. They dump the information to the insurance company. That usually takes 3 or 4 weeks. So most patients are almost done with PT by the time they get a bill. And a lot of my patients were ending up with bills between $2,000 and $3,500 they weren't expecting.
Oh, wow.
And that's because on the back end, insurance was denying certain treatment codes. And so I thought there's got to be a better way. And so what most people don't understand is about a 40-minute session at an in-network clinic is anywhere between $450 to $650. And at a hospital-based service, it's well over $700 an hour.
Wow.
And so most patients, if they have a high deductible, are paying anywhere between $400 to $650 a session before their deductible is met.
Wow.
Yeah, so that's why I went cash-based, because we are much less expensive. We don't employ therapy aides, so that means our patients are seeing physical therapists who specialize in pelvic health the entire
Everybody's
session.
a pro.
Yeah,
and
exactly.
pelvic floor. Yeah.
Everybody at my clinic is, because I am very I'm very picky.
I love
about who I will
that.
hire. Yeah.
It's so important. And then where is your second office?
Second office is in Carmel off 116th and Keystone.
Oh, that's your second one. I thought that was your newest one.
That was my second one. The newest one is off of 421 on Michigan, over West Carmel, Zionsville.
Oh, okay, cool.
Yeah. Yep. We see people from everywhere, so I try to be really strategic. We see people from all over the state, but we also see people from Illinois, Kentucky, Michigan, Wisconsin, and Ohio.
I love it.
So trying to be strategic about our locations.
And then did you start in 2013, or when did you start your business?
So I started my cash-based boutique business in 2016.
Oh, okay, cool. Oh my gosh, you're almost coming on 10 years.
I know, it's hard to believe.
That's so exciting. I can't believe 2016 was almost 10 years ago. That's wild.
Yes. I can't believe I've been a PT for 30 years.
Wow, that's amazing.
No,
now, where did you start with the PT? Like just like general, or did you always want to get into pelvic floor?
So I always, I was an athlete in high school, and
What sports?
So I was a swimmer. I was track and cheerleading.
All the sports.
And so so I actually leaked urine as a high school athlete, and
wow.
My mom was a nurse, but you're a kid. You're too embarrassed to say anything.
Mm-hmm.
It was when I got into physical therapy school, and we had a 45-minute lecture on pelvic health, and I thought that's really cool. I think I want to do that. And then I thought, well, I can't tell my classmates, are going to think it's weird. And of course, walking out of lecture hall, they were all talking about how strange that woman was. But I always say God kept putting it in front of me.
I love
kept
that.
showing me patients that would benefit from it. And I purposely went to a hospital for the first year because it gives you experience in basically everything.
Yeah.
Right? And God just kept putting it in front of me and putting it in front of me. And yeah, I knew it's what I was supposed to do.
That's so cool. I love that.
Yeah, it's awesome.
So did you start doing it at the hospital first, or you started your own practice and then got to specialize in it?
No, so what happened was I worked at the hospital for a year, then I joined another company, and I love old people.
Yeah.
And so I worked at a long-term care facility, but was like full continuing of care, independent living all the way to assisted living. And the company I work for, I talked to them about it, and I actually started a program at that facility. And I was very fortunate. I had an education director that got behind me, and, most pelvic PTs are lucky if their employer will pay for 1 or 2 courses a year. And in order to become really, really good at pelvic health, it takes so many courses to become really good at it. So I was fortunate to have an employer that was paying for a minimum of 3 courses a year, and I was usually paying for 3 more courses a year for the first several years to really become proficient at treating pelvic health. So I was very lucky. I had an employer that was behind me.
That's when you know, like, you're on the right plan. God just keeps showing you the next thing to do.
That's exactly right. I say that all the time.
I love that. So how many physical therapists do you have working for you now?
So let's see, there are 7 of us currently, and we've got another one starting next week. So there'll be 8 of us total.
Fun.
And I'm looking for another one for Carmel.
Ooh.
Yeah.
Any Carmel physical therapists looking for a
pelvic
fun
health
job?
therapist.
Pelvic health therapist, yes.
Yes.
Yeah, we went to see Dr. Murphy. He's been on the opposite. He's done a lot of my TMJ dry needling. This first dry needling session I've gotten.
Okay.
Yeah. And we would follow like the acupuncture book, and I really want to get him and Portia together. Portia's an acupuncturist, so she's been on the channel many times. And just watch their brains work. And we're just like, let's match up what you know with what I know. See what kind of cool things we can come up with together.
That's great.
It's fun to play, to learn and play.
It is. I agree.
That's what we love to do on the channel here. So if you love to learn, grow, glow together, you're in the right place. Make sure you join the Ella Bardo Besties Club. It's totally free. You just subscribe, and then you're going to turn on all of your notifications, because this is where all the besties come hang out. We come hang out in the chat. And then when you turn on all of your notifications, it's going to let you know we're all getting together. And if you're available, you should come hang out with us. Hi, Lainey. How are you? Oh, Lainey's a paramedic. We have a pelvic floor physical therapist with us. It was a year ago, I think we did the first Flux with friends. And she was telling us, she did yoga for pelvic floor health. And she was like, you gotta meet with the PT. And now a year later, we have a real one live answering questions with us today. Isn't that amazing? She's cooking right now.
Hopefully she's making something good.
No, you're cooking.
Oh, I'm cooking.
Yeah. So anytime we have the towel on your face like this, and we have the wands touching, we've got the Jade Frequency-Specific Microcurrent on. So right now we have it on a frequency for pain, inflammation. It's like softs up any kind of like clenching stuff. And no matter what color we have it on, whatever frequency we have it on, it's always increasing collagen by 22%, elastin by 48%, doubling the length of the elastin fibers. And I know collagen is very important. It's important for our skin, for our joints. We actually have like 28 different types of collagen. So important. But what gives our skin its elasticity, what keeps it tight, a big part of that is elastin. And this machine helps to recreate that 48% more, and doubling the length as well. So what's an elastin, you might ask? I love that these cords look just like an elastin fiber. It's like a curly phone cord, if you're old enough to know what that is. Yes, phones used to have cords. I have an example in the other room, but we're not going to go get it right now. Maybe later, if you're good. So after a while, these cords get stretched out due to aging. Our bodies, stop making things that we need, like ATP, elastin, collagen, all those things as we get older. Sun damage, injuries, anytime we're stretching it out, it doesn't necessarily go all the way back, right? We want it to be tight like this. So every time that we're using the frequency-specific microcurrent, everywhere the towel is touching, we're creating almost 50% more of these brand new ones that are double the length and tight. And then they're tightening back up with your existing elastin fibers and bringing that all back together. So why just do one if you can do both? Now, I still love my collagen supplements, It's just amazing that we have all of this new information for biohacking, and why not do it all? I am that guinea pig for you. I will try it. We will film it on the live stream if you like that, or if you have any suggestions for cool things. What do you think about stem cell injections in the joints?
I think it's helpful for a lot of people. We actually have a soft wave shockwave that actually produces stem cells.
Ooh, really?
Yeah, so it calls stem cells to the area, which is really cool.
Now, you do that on the hips,
you can do it all over, yeah.
Oh, so it'll work on the soft tissue and the joints?
Uh-huh.
That is amazing.
Yeah, it's pretty cool.
That's so cool. How long have you guys been playing with that?
Oh, just roughly about 8 weeks now.
Ooh, exciting.
Yeah, so it's been great. It's been really, really helpful.
Can you tell us some fun stories about what kind of results your clients are seeing with it or feeling with it?
Yeah, so I actually had a client come in who had starts of a frozen shoulder, and she was missing about 20 degrees of motion in all planes. And in one session with that, along with manual therapy, she had regained all of her motion, which is, normally would take several sessions.
Oh, wow. I love that.
3 to 4 usually to regain that motion. Client with pelvic pain, you can do soft wave. It's external only, but you can do that, and it helps with that along with sexual dysfunction. So it helps men. The list goes on and on. It helps with arthritic pain. It helps with meniscal injuries. You name it. It helps with all kinds of things. It's really very amazing. It decreases inflammation, increases blood flow, calls stem cells to the area. It's an awesome device.
Oh, that's so fun. I'm so excited to hear about your stories with it after you've been working on people with it for a year. That sounds so cool. See, biohacking, we're always learning the new cool things.
Yeah, so I looked at that machine for about 3 years before I actually bit the bullet. It's it's quite expensive, but I
Okay.
finally felt like that I could no longer
Not
not
it.
have it.
I
Yeah.
love it. I love that. So we're gonna do a little tuning fork therapy here. Now there's frequencies that are going through. We already have it on the blue frequency, so we're already aligned for that. And
Is it okay if I blink a lot? I can feel my contacts just drying out a little bit.
yeah, you're right. I got some saline stuff too.
I'm good. Just try not to move too much.
So then you were telling us that there's different frequencies we can make with our mouth that can help things from like labor and like they can help with the pelvic floor. Like if you make certain noises or certain humming.
Yeah, so like a lot of people, believe it or not, are not having bowel movements correctly. A lot of people strain. And so if you can make different sounds, and everybody's different, right? You can do
So it's different sounds for different people?
Yeah, exactly.
Oh,
so there's
wow.
different sounds we go through to see when the pelvic floor relaxes the best. And it's the same for delivery. When we're teaching women how to relax their pelvic floor for delivery, there are different sounds that you can make. Believe it or not, a mooing sound works for a lot of people.
What? That's cool.
I know. So it really just depends on the person. So we assess that as well.
So do you have like key sounds that they try?
Mm-hmm. Yeah, there's
Like
lots
how
of
many?
different sounds like ah, oh, gur, sh, moo.
Then how do you find the right one?
Literally, you are doing a pelvic floor assessment and or using biofeedback to figure out when the pelvic floor lets go fully.
Oh, that's so cool.
Yeah, it's really, really helpful. And you think a lot with, pregnancy and stalled deliveries and different things. A lot of times you've got one side of the pelvic floor relaxing and the other is not. And, if you can teach women positioning and along with proper pushing, it is super helpful.
Yeah, I help a lot of women with the non-invasive mommy makeovers. And, now we've been doing it for 12 years. And I see the women who recover fastest. And they're the ones that were like ready. They're ones that were in shape, that were already working out, that, even getting rid of cellulite before a pregnancy can help with that because you're getting better circulation, better lymphatic flow to you and the baby. And I definitely, especially a lot of women, are waiting later to have children.
Yep.
So I see a lot of women like that and that, doing the acupuncture, getting everything balanced. I've had a lot of clients we've referred to Portia that have had very good health with that. But I know that there's a lot of people who end up, going through something unfortunate before they get recommended to see a pelvic floor therapist. So I would say like anybody, especially like over 30, or if you've got issues running and you're planning to have kids, it's not like a surprise, that it would be really smart to get all of that checked out with a pelvic floor therapist beforehand so we can get the oven ready,
I wholeheartedly agree with that. We love to have a baseline before women get pregnant. And there's so much that we can do to help women with conception, which is not well known, that pelvic physical therapists can help.
Yeah, can you tell us more about the different things? Because there's so much, I tell that to my clients all the time, to see the hormone people, to go see all the people, especially if they're over 30, closer you to 40, and especially before they're, investing directly into the fertility stuff. I just feel like there's other stuff getting the oven ready, before just that, so you can have a full picture.
Yeah. I mean, there is just so much that people don't think about as far as just the readiness of the uterus to be able to accept an embryo, accept implantation, maintain. You have to have adequate blood flow. You need good lymphatic flow. And so visceral mobilization is a very specific type of manual therapy that really helps prep the reproductive system. And it's very precise. And I always say it's just like having a conversation with the nervous system. So I worked for a company for about 5.5 years that all we did was fertility work. And it's really, truly amazing how many women we saw that had gone through multiple rounds of IUI or IVF, never carried, and then they came through physical therapy and carried to term. It's really amazing.
Yeah, I know people who've like went through a lot of that or went through, you know, some tragic experiences before they found out that their like womb was crooked and could be, you know, readjusted and rebalanced out with physical therapy. And to, you know, imagine how much money and pain they could have saved if they would have went through that ahead of time. Now I just want to tell everybody about it, you know?
Yeah, and I have a history. So my husband and I had undiagnosed endo and PCOS, so we couldn't have children, and that's how I got into this. And you do have to get very specific training in order to be able to evaluate and treat specifically for that. And it takes a team, like you said. It's not just us. We're working with their physicians and with anyone else we see. We work with acupuncturists. It really depends on what each client needs.
Yeah, I love that. Yeah, I have a lot of clients with PCOS because that's something that I experience. And pretty much everything that we have in the spa is something that I've used to solve my problems, my symptoms rather, of PCOS. Haven't figured out the hair thing though. I can make it grow less. You know, I've had clients that have gotten treated for that and fertility with Portia with the acupuncture, where I've seen them come back and it's like 30% less after a few sessions. That's been amazing. I was like, poke me for that one too. Like, I need that one.
Yep, it can be challenging.
And everybody's so different with like how they experience it too. There's no like one saw. I'm like, this can help with this helps a little with this, you know. But I'm the kind of person, I'm like, okay, well, let's try to figure out all the things. That, and then with like the TMJ stuff, like that we were talking about. That's another way that that's really how I got into the pelvic floor health, was I was reading that like having like a clenched jaw or TMJ can mean a tight pelvic floor. Is that right?
Yeah, absolutely. So I always tell people, you put food in your mouth that comes out the other end. So if you clench your teeth, you can feel the anus tighten. And so a lot of people who clench their teeth a lot have actually a pelvic floor that's tight all the time, and the brain gets used to that tension and thinks that's normal. So a lot of times we spend a lot of time down training the pelvic floor first.
And so are there workouts that you do with or exercises that you would do with your mouth to help to reset that or back?
You can, for sure. I mean,
or
obviously,
when you train the pelvic floor, it helps this.
Well, it's both ways, right?
Okay.
Yeah, it's both ways. So a lot of times we'll do needling with stem to the muscles of the jaw, and then fascial work on the muscles of the head, neck, jaw, and then you work it with breathing, getting all of those things to work together, and you work a lot in fascia. Fascia is missed and really important.
Yeah, we're learning more and more about that every day. It's amazing. Yeah, well, this tool that we use here, along with the flux, helps to get rid of cellulite. And there's so much to do with both the lymphatic system, the detoxing, skin tightening, and the fascia. It's like a mix of all of that, and it's going to be different for everyone. And cellulite is really like, when you see it on the skin is the largest organ of the body. So it's like our like red light. You know, when we see something we don't like, we should really be asking our body of like, okay, what are you trying to tell me? Why do you look like that? Why do you feel like that? How can I help you feel better? Instead of trying to just like cover it up. If we just try to cover it up, you know, we could be missing important signals that our body is trying to tell us about other parts of our bodies. So after doing lots of treatment for cellulite over the years, I realized that when we were getting rid of the cellulite, making it look better, it was also helping to relieve like chronic pain, increase mobility. And I'm like, oh, that makes sense. Imagine you have a hinge and there's a bunch of gravel in that hinge. You're not going to be able to shut the door all the way, right? But, you know, it was years into it. I'm like, oh, look, here's a bonus thing. But then also I do recommend my clients to go work with a physical therapist afterwards, because whether that's from like an old injury or you trained on it wrong or you haven't moved a lot, it's, you know, we might be able to get rid of the easy button went off by itself. The spa fairy Susie is here. She agrees. But yeah, if you're not retraining, like what we were talking about earlier, like going to see a therapist, personal trainer, whatever fits for you, to get the brain and the body reconditioned, you're gonna build those toxins back up in those same areas. That's why people will be like, oh, why does this keep coming back in this spot? It's important to like know how your body's moving and how we can get it in better alignment, and then you're gonna have less buildup in those undesirable places.
Very true. Very, very true. People don't understand how important posture is.
Again.
Posture affects everything.
Oh my gosh. That's twice. Oh my gosh, it's good luck. Were you saying posture?
Posture affects everything. It really has a big impact on your breathing diaphragm and your pelvic floor and how they function together, and how well your abdominal muscles engage. A lot of people who have repeated tightness of the low back, it has a lot to do with posture and the way they sit and stand. And it affects everything fascially too.
Yeah, there's a professional ballroom dancer coach that I follow, and she does those little shorts all the time about posture. She's like, bad posture can make the most expensive dress look horrible.
Truth.
And good posture can make the cheapest dress look great. She does such a good job of sampling that. Actually, we have a waist. It's not really a waist trainer. It's actually a back brace that they made look like a corset. My friend Diana, she's been on the Flux with Friends episodes too. She makes these for kids in show choir because it helps create space for their diaphragm, and people in Cirque du Soleil.
Oh, wow.
So you don't want to wear these all the time. This isn't the one that rearranges your organs. Those ones are not good.
Right.
But this is great if you're sitting for long periods. So I will try to wear this on my longer days with clients, and it does help to retrain the posture. But you can't use this alone. You're using this because, especially, it's saving me from the tech neck. It brings my shoulders down, builds up less stuff in there. But then I'm also doing different workouts to retrain the opposite. One that we learned with Amber from D1 that was great. And it was like a push-up, but then you put your stomach flat on the ground and almost do a Superman.
Okay.
And I was like, oh, that's easy. You want me to do a push-up but lay on the ground? What? But it really gets right into that area in my back where all of that builds up. How do you feel about the vibration plates?
We use them in the office, yeah.
Oh, you do?
We do, yeah.
Yeah, back in the day, those, you would have to go to a professional place to use those. I know a lot of chiropractors that have been around for a long time who've got, the big expensive ones. Now you can get nice ones for at home for...
Nothing,
literally.
right.
I think I paid $400 for mine during quarantine, and now you can get the same one for, $150.
Yes, yep.
I've got a mini one here at the office for, $99.
Yes.
And one of the best at-home things that you can do for cellulite. Don't get that stupid thing from Ashley Black, whatever that is.
Don't get that, I agree with you.
Oh, that is causing broken blood vessels. Fascia blaster.
That thing's terrible.
It's so horrible. Foam rollers are great. Oh, you know what I have that I love?
What's that?
It's vintage. It's one of those, now they're coming back in style, but they're $10,000. But it's wood therapy on a motor. Do you know what I'm talking about?
No, I don't. No.
Okay. I'll have to send you a video of it. But they're coming back into fashion. They were back in the 20s gyms, the women's gyms, where they would have those and the vibration plate, but the belt went around you. I think there's something to that belt going around your waist, though. What do you think? I just have the vibration plate, but I thought about putting different hooks into the wall at different heights.
Yeah.
To have it kind of shake out around the waist or around the hips or something.
I think there's lots of ways you can look at that. You can look at vibration, and there's so many things you can do to make it work differently.
I have that thing that goes over the door that could work for that. We're going to try that on the live stream later and see what happens. I think I have everything we need already.
That's funny.
Yeah, a lot of the active recovery is just now becoming like popular again, but that can be super fun.
Yes, definitely.
What other at-home things do you like to do for like active recovery, or what are some ones that like, you know, almost all your clients get?
I mean, honestly, we do not have any cookbook approaches to anything. We really do customize to every single client because people are just so different.
I love that. And you work with a lot of athletes too, don't
We
you?
do. We do. We work with a lot of F45ers, CrossFitters, Orange Theory. We actually, I can say it because she posted our own page. We actually had a client who just went to Ironman in Kona. She qualified.
Wow,
Yeah.
that's amazing.
So she's amazing. She's absolutely amazing. So we do treat marathon runners and some professional athletes as well.
So fun. So especially depending on their sport, if they're gonna have kind of repetitive motion build up injury, I see that with like where stuff builds up. Like I have a girl, she's been doing her face for years, and she wanted to lift the skin on top of her knee. So we did that. We were tightening it, but I could tell she had like a little bit of cellulite buildup on the inside of one leg, and then it was like long up the calf and on the back of the hamstring of the other. And I don't know the technical words for tennis, but I was like, I could tell. I was like, okay, this one's your serving leg, and this one's your skip leg. She was like, yeah, how can you tell? Because I can tell where the toxins build up on the muscle, different places, like where the cellulite is. It's so cool.
Great.
So a lot of what you do is kind of blind, like your fingers are your eyes.
Our fingers are our eyes, but the soft wave, shock wave is also you can diagnose with that.
Really? How
it's
so?
actually really cool. So it's called mapping, and you use the sound head and you map, and it will show you, like people will feel either mild pain or discomfort where the issue's at. So we treat a ton of physicians in our practice, and I had a physician come in just recently, and she pointed down her leg, and I'm like, well, that looks like you have an issue with your lateral femoral cutaneous nerve. I'm like, but it also could potentially be your femoral nerve. And so we were able to use a soft wave to map that, in fact, it was the lateral femoral cutaneous nerve.
Wow,
so we were
it maps
able to
the
treat
nerves?
that. Well, that's what the problem was for her, so it did map that.
What else will it
And
map?
so
What other kind of things?
it can show you where in a muscle the problem is at.
In just like one session?
Oh yeah, I mean you usually map over 2 to 250 shocks. If you have a large area, it could be more, but then you go right into treatment.
So one, like, you know, one setting, it's like taking like a diagnostic image with.
It's not an image. It literally is. Patient can feel it. Like they can feel, and a lot of times it's really weird, but as you get used to using it, you actually feel the difference. And shockwave sounds scary. It's not a shock. It sounds like it's shocking you, but it's not. It's almost like a gentle rubber band tapping feeling. But you almost, as you're mapping, you can almost feel a difference in the actual tapping when you're over a problem area.
What do you mean by tapping?
So it literally is, the shockwave is like a tap. You know how you get flicked by a rubber band, and it's like tap, 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 tap.
Oh, so if you're over a tough spot, it'll feel tougher.
It'll feel different. Yeah.
Cool.
It feels different.
So kind of like
cool.
kind of like what we feel with the face sculpting.
Yeah, exactly.
That's so cool. But it's like taking pictures and like telling you that's amazing.
But it doesn't take pictures. It doesn't.
Well, I can see it like, so I'm autistic, so I can see it. It's telling you like, if it's taking a picture as if it's giving you information. So it's giving you information so
absolutely.
you can see the picture in your head and know what to do.
That's exactly right.
So
yes,
autism.
that makes sense.
Sorry.
No, I totally get it. I 100% understand.
It's creating communication to solve a problem.
That's exactly right.
Yes.
I like that. Yes.
That is so fun. Oh my gosh. Now I'm even more excited to see how you feel about it a year from now. You're going to help so many people with that. That's so cool.
It is really, really cool. Like, I really did watch the research. There's so much more research that's going to be coming out about it. It's amazing.
And how long has it been around?
It's been around for a while. I don't recall exactly for how long, but it always was seen as experimental.
Okay.
But now the American Neurological Society is classifying it as a legitimate
Neurological or
treatment.
urological?
Urological.
Okay, so
Yep,
okay.
Society is it's a legitimate tool, and it is ranked up there as one of the things to try, which is great.
That is so cool.
Just like anything, with more research, you know, really proving that it really is doing a lot of great things.
I love that.
So it's just one tool in the toolbox of many.
We love all the toys here,
I know,
for sure. We
I'm
love
with you.
learning all the toys, learning about the toys.
It's great.
And there's so many. So we have a lot of specialists on here. So the specialists know like a billion different things about the one thing, you know?
Right.
It's just like a treasure chest of knowledge. So even just like in regular esthetician world, I don't really want to know about waxing. Can I do waxing? Yeah. But ever want to do it again? No, I don't. I'm going to send you to somebody who just does waxing because they love that. They're going to do a way better job than me. Now, when it comes to body sculpting or snatching up that jawline or getting rid of scar tissue or any of that kind of stuff, that's where I am the very best, absolutely. You can book an appointment online at ellabardo.com, ELLABARDO.com, and then just click on any of the book now buttons. How can they book an appointment with you?
They can go to www.restoreyourcorept.com, and there's an online link there, or they can call or text 317-597-6323.
Awesome. So now you've got 2 Carmel offices. Where are they from the spa?
That was easy.
Again? Apparently, Susie thinks it's very easy to get to. That is wild. That thing has not gone off on its own since I had a doula in here, and it went off twice, maybe 2 years ago. We got 3 times, so you're the winner now. It's gone off with you more than anyone. Susie really likes you.
Susie's great. I like the easy button. So where are we located from here?
Yes.
So from here, we're just right up, basically range line to 116th, and we're behind that McAllister's on 116th Street. And then the other one is basically, you can go up range lane, turn right on 116th, take that over to Michigan or 421, and we are just basically up the road from there behind the Starbucks.
Oh, nice. That's really close.
Yeah, so both are really easy to get to from here.
Yeah, I go to kickboxing over by your Michigan road location.
Oh, yeah?
Mm-hmm.
Where's that at? I mean, who is it?
It's by Target.
Okay, yeah. Very good.
I love it. It's 24/7, so.
Very nice. How long have you been doing that?
So I started martial arts when I was like 12. I was doing taekwondo, so lots of kicks and judo.
Mm-hmm.
And then I did it, like Krav Maga, jiu-jitsu, a bunch of different stuff until I started my business. But then, like, I need my hands to not be broken. So I did some different conditioning stuff for a while. And then I found that place, which is cool because it's like, it's just a circuit. So when I just don't hit the heavy bag with my hands, I'll hit like the speed bag and I'll just do extra kicks. And
is it like a 30-minute?
It's 30 minutes, but I usually just go when there's no one else there and just like kind of do my own thing. Like, I take the suggestion, but
that's wonderful.
I love it. I found that on the ClassPass. Love ClassPass. So how do people find you? Usually word of mouth?
I would say a very large majority of our patients are word of mouth referrals.
I love that.
But I have been around for such a long time. I have a lot of practitioners that I've known for most of my career, and they refer a ton of patients as well. And then, like I said earlier, we treat a lot of physicians and nurse practitioners. And
okay.
Yeah.
Those are great referrals then.
Yeah, and I'm just very fortunate. I always say we've been very blessed.
So how soon, like, into physical therapy school do people get into the pelvic floor house? Because you said you've got seven other therapists?
So 7, soon to be 8 next week.
Oh, congratulations!
Thank you. So in physical therapy school, you really don't get into pelvic floor. Basically, in total physical therapy school, you're in school a minimum of 7 years. And I had a 45-minute lecture on pelvic health, and most schools are only up to about an hour these days.
Oh, wow.
So in order to, now you do have a few schools that have like some residency programs and whatnot, but that's few and far between still. So in order to become a pelvic physical therapist, you literally have to go back and take all the coursework after you graduate from physical therapy school. There are some PT students that are taking some of the classes while they're in PT school now.
Oh, cool.
But it's you have to invest a lot of time and a lot of money. I've got, it's hard to say, but over $200,000 in my continuing education in pelvic health.
Oh, yeah.
So
That's with like so many things, you know, if you want to be successful, but it definitely pays off.
I love it though. I love it. It's so much fun.
Yeah, I train a lot of estheticians, and I'm like, you know, esthetician, that pretty much gives you a license to go spend more money to learn what you really want to learn if you want to be successful with it, you know.
Very truthful. Yeah. Well, you've got a really great business.
I love it,
Very,
you know.
very specialized in what you do. Very
I
good at
love
what
it.
you do.
Thank you. Yeah, I love it. It was definitely a similar kind of thing where I started off pre-med, and I wanted to get into either like neurology or like pharmacology. I wanted to figure out like stuff with autism and that kind of stuff. Like, how do we figure out? And in my mind, I was still like, oh, we could just make a drug to fix it. You know what I mean? Because we were kids, and it was, you know, the early 2000s. So that was kind of like the vibe, you know?
Yes.
But then I ended up getting super stressed out, getting perioral dermatitis, trying to keep all my scholarships and stuff. I didn't try. We kept them, but my skin,
Yes.
it took it out. And through thousands and thousands of dollars with the dermatologist, my face just kept getting worse and worse and worse. It was eventually falling off. I couldn't work. I work in a restaurant. I can't have, like, my face falling off.
Right.
And then my mom was like, hey, the lady who does my eyebrows does organic facials. She was actually doing Ayurveda, which is like Indian medicine.
Mm-hmm.
And she gave me a 2-hour facial, and it was like 80% better. And I cried. I gave her all the money in my wallet, and I started just like studying under her. And I switched to biomedical engineering for a while. And it's weird how it all kinds of comes like full circle. I was like kind of knew which direction, but you know, I like being in wellness.
Uh-huh.
Come see us before you break. Or, you know, a lot of times when we're making you pretty, I can be like, oh, that's not right. You should go talk to this person, or you should go talk to this person. And they do it the more serious stuff. I like being in my wellness bubble.
That's great.
And I will have clients. We talk about this with, you know, Megan, our therapist on there. And, you know, other helpful people. I have clients who are like, what is this? I'm like, that's something that you would go to a dermatologist for. That's something you would go to, you know. Well, you tell me what it is. I'm an esthetician. It's not my job. Outside of scope of practice. I can tell you, here's 5 different people who might be able to give you a qualified answer, but I don't know. Especially if you're not going to listen to the other 17 things I told you to do. Like, stop drinking.
That was easy.
See how easy it could be? 4 times. 4 times. That one's going to be hard to beat. It could really just be so easy if people would just, like, stop doing certain things.
I agree.
How many less problems? We were talking about this earlier today, too. You know, I just get to a point, I'm like, look, best I can do is sending love and Reiki vibes. I don't know. Like,
Well, everything starts from the inside out, right?
absolutely.
So, toxins, you name it, gut health, all of it. It all plays a role.
Yeah, so when you were talking about how you educate your clients on a lot of that when it comes to pelvic floor health, too. It's not just exercises and, you know, shockwave therapy and the manual stuff. What kind of stuff do you see in your practice when it comes to kind of guiding people on nutrition and stuff?
So we talk a lot about stress management. We talk about the toxic load.
Tell us more about the toxic load. I'm doing a parasite cleanse right now, so
Yeah.
look how good my skin looks, y'all.
It does look very good. No, but we really talk, I mean, we work with other people because it's not what we do, right? But we have a team of people that we do work with, and, you know, there are so many people. There's so much junk in our food these days. And so everything you're putting in comes out in some way. There's a lot of people who have food sensitivities that can show up as joint pain. But as you know, I'm here with you. It can show up as skin irritation.
Yeah.
And so,
Oh, absolutely.
you know, there's just a lot of things. But we talk about sleep, stress management. You know, we have a lot of people who've been on a lot of antibiotics, and a lot of those people have leaky gut, rebuilding that gut lining, getting everything kind of back in balance again.
Balance is key.
It is.
And there's so much that, you know, I think my mom went to someone and she had a rib that was off forever.
Oh, we treat ribs all the time.
And the rib that was off was causing a lot of her hormone issues because somehow it was pushing on her lung that was pushing on her uterus or something like that. Is that something you've seen before?
So
She had to go to so many therapists before somebody who had been doing it forever was just like, oh.
Yeah, ribs are very easy to fix, but I'll be honest, we didn't learn it in PT school.
Another continued education or like on the job kind of?
Continuing education. I'm the kind of person that if I have a patient that I can't figure out how to help them, I go on searching for the next course to be able to figure it out for the next
love
person.
it.
And then if I can't help somebody or one of my therapists can't help somebody, we refer them on to somebody who can.
Yeah.
It's nobody can know everything.
Team effort.
That's right.
Yeah.
Yep. But yeah, rib dysfunction is more common than people realize.
What all things can that affect?
It can affect, I mean, it really, depending on what rib it is, it can affect so many things.
Oh, that makes sense.
Really
I didn't even think about which rib.
Yeah. Yep. It's endless.
Deeper down the rabbit hole we go.
That's right. A lot of women after having babies have rib dysfunction that gets missed.
Yeah, so great question, Ricardo. This is a cleanser. So the first cleanse that we do is always with a grapeseed oil or my Ella Bardo oil blend. With new clients, I just like to see how their skin responds just to the grapeseed. Grapeseed oil is antimicrobial and it also helps to balance hormones, so it's good for everyone. The molecule size is small, so it doesn't block your pores. For the second cleanse, we use the 24 karat gold cleanser. Now, gold is super fun and great for your skin, but when we're using electricity, it's super duper great for your skin. So I love using gold with any of the electric modalities that we have. And then this is my little Tesla wand, Tesla high frequency. So this has an actual Tesla coil in it. And then the specific frequencies go through the Tesla coil. So it's just absolute magic. Absolute magic. We call it my lightsaber. So next we're going to be moving on to the frequency-specific microcurrent. So it's kind of like 3 cleanings in 2. Well, kind of 2. The first one's kind of like 2 as well. Because we're really like moving a lot of lymph and kind of retraining the face muscles a little bit aggressively. But she's a PT. She likes it, you know. She could ooh, I feel that's fixing something, you know.
Keep it up.
It's good her. Okay, so now we're gonna stimulate that lymphatic system and tighten the skin up here. Lift up. We're gonna let her chest cook. Because I think we need some new towels. I'm going to change the frequency here. So no matter what frequency she's on, it's always going to be tightening the skin, increasing ATP production by 500%, increasing circulation, lymph flow. The frequency that we have it on now is also going to help to kind of soften up any type of lymph stasis, lymph blockages as well. So, you know, we did that manually with the hands a little bit. The frequency is going to get it going here before we start the sculpting with the magic wands. That was the sculpting with the magic hands, then the magic lightsaber. Next comes the magic wands. So can you tell them a little bit more about with the soft wave? Are you having like more new clients come in? Are you having clients who've been like long-term loving you guys?
A little bit of both, actually.
Can you tell them stories about a little bit of both?
So we just had a client come in. who had an onset of acute neck pain. And so we were able to use soft wave in order to map where the issue was at, and then also treat actual spine. She had known arthritis. And so obviously it doesn't happen in one session. And so basically she'll come in for a package of 6. But she actually felt about 60% better when she left the office. We also have a gentleman who has issues with erectile dysfunction, and we can use soft wave externally to help increase blood flow to the area, decrease muscle tension, and help with that. And erectile dysfunction is a little bit different. It depends on how long it's been going on, depends on if they're using medication, how often they're needing medication, if the medication is helping or not helping. So a lot of times erectile dysfunction requires more shocks, and I know shocks, I hate that because it really isn't shocking you. I can't say that enough, because who would want shocks on their genitals? No one. But yeah, it is incredibly helpful for that as well.
Now, that's not something people can just like book an appointment for. They have to book an assessment with you first, right?
Yeah, so we really do encourage patients to book an evaluation, because it allows us to see what their full medical history is. It allows us to understand really where we need to be looking, where the problem is at, versus just, we don't do just shockwave on its own. We just really don't feel like that is helpful for patients.
You got to figure out where the problem is first, right?
Yeah, and you know, knowing somebody's history, I feel like a lot of times in the medical world, because insurance is driving a lot of that, we don't have to be driven by insurance, so we take a thorough history on every patient, because history is crucial. It guides you on where you need to look. It's really very much missed in a lot of the medical world today.
Yeah, we've talked about this with a lot of different private practices, both like in hormone health and physical therapy. And I would almost like prefer somebody I could just go to cash, because I know that they don't follow those same restrictions. They're just going to do what they know works.
Yep.
They know what they're doing. And I just want what works, you know? I know a lot of times with insurance, you'll have to go through like 7 different things before you get to what you really need. Just give me what I really need, like right now. Like,
Right.
You get on the right track. And it's nothing in like health and wellness is like you're going to be fixed forever in a day, but you just want to get on the right track as soon as possible, right?
Well, yeah, that's right. And you know, I say all the time, I don't know why we ever, in the physical therapy world, it's almost like people are told go to physical therapy for 6 weeks and you're healed.
Right,
well,
that's true.
I always say we all live life, and other things always come up.
Yes, I've broken so many bones. And repetitive motion injury, it's like a constant thing. The older we get, you know, that's why it's so important to learn about all that stuff the younger we are, so we can keep an eye on it, you know?
That's right.
So you have certain people who will come for like maybe a specific injury, and you get that generally fixed up, and then do you have people who come just, you know, who are athletes, maybe they come once a month, or
we actually have people who come for maintenance. That's one of the reasons, after the money issue, because, you know, I don't like, you know, when I was in the insurance world, people getting big bills they weren't expecting. That was the number one. But number two, I had so many patients asking if they could come in for maintenance treatments, and in the insurance-based world, you can't do that. But in the cash-based world, you can. So we have a ton of patients who come in monthly. Some come every other month. We have a few that come every 3 months. So it really is just keeping their body in tip-top shape.
Yeah, I mean, the more I learn about it, I think it goes right in there with, you know, yearly, quarterly, whatever maintenance, just like, you know, seeing a personal trainer or massage therapist or chiropractor, you know.
Mm-hmm.
Might not come, a lot of my people, they'll come to see me, you know, 2-3 times a week in the beginning till we get them where they want. And then it's good depending on the person, how busy their lifestyle is. Sometimes people will come to see me once a week, once a month, every quarterly, just to keep up on, you know, the success we've already created. We gotta maintain it, you know.
That's right.
So you can't just brush your teeth one time. You can't just go to the dentist and get your cleaning twice a year. You gotta brush and floss in between.
That's right. Keep it up.
Yeah, so yeah, the brushing and the flossing, or like with my clients, like using the right skincare products, not putting poison on their face, you know, making sure that they're being mindful with what they're eating because that will come out of your face. What kind of aftercare stuff besides exercises? Do you have people like do the humming of the frequencies as one of the exercises?
So it really kind of depends on what they're there for. You know, a lot of our clients, to be honest, we live in a very upregulated society. So a lot of our clients will have them do deep breathing. And if they have a tight pelvic floor, there are certain positions that help with relaxation of the pelvic floor. But we also do a lot with the vagus nerve. There are different things you can do. There's a TENS unit that you can use an ear clip. And so it can help with down regulation of the vagus nerve.
Yeah, I was gonna ask you, so like, what kind of stuff do you do with the vagus nerve?
So you can do humming. There are certain exercises that can be done with eye movements and or you know, different positions.
Eye movements, so workouts with your eye movements?
Yeah, but it's very specific. Like you have to follow like a specific protocol. You know, a lot of our clients, because they're so busy, we treat like a lot of business owners, people who travel a lot for business, moms who have multiple children. A lot of them really like the TENS unit with the ear clip for the vagus nerve because
cool.
they can put it on, they can do their thing.
You can just walk around with it?
You can.
Oh, that's neat.
You know, for most people, it chills them out. We have a couple people that say it really focuses them. So we have one patient who puts it on to clean her house because she's like, I get focused, I clean my house.
What? That's so cool.
And so it's like become one of her favorite things. Yeah, but I mean, there's different ways that you can do breathing. There's so many things that you can do to help just decrease your nervous system upregulation.
Oh, yeah.
And most people these days need that.
That was once the first thing I got dry needling. I was shocked about. Because, you know, I do a lot of different holistic things. I do all kinds of things where it's like, hey, you're going to be tired after this. And I'm like, no, I'm not. And I'm usually not. The first time I got dry needling, oh my gosh, I was pulling into Whole Foods. I think I got it at like 12:30. And I just remember pulling into Whole Foods, getting groceries, and I'm like, man, I'm probably gonna go to bed by like 6 tonight. In my mind, I thought it was like 2 o'clock. It was 6:30 already. I was like, where did this time go? Oh my gosh. Every time after that, same thing happened with acupuncture the first time. I felt like drunk afterwards. Every time after that, I was very energized.
Okay.
But it did something with the parasympathetic nervous system.
Which is great. We need that.
Yeah. In today's world.
We do.
Full of stimulation.
Dry needling is pretty cool, especially dry needling with e-stim, because you can use the e-stim to either calm a muscle down or engage a muscle more, depending on the settings that you use, which is pretty amazing.
So with Dr. Murphy, we played around with the dry needling and hooking the frequency-specific microcurrent up to it. And then with Portia, we tried it with the acupuncture. And both were very fun. Still, it's fun to have experienced both, because and Dr. Murphy, he does the dry needling with like an acupuncture twist. Now, Dr. Elizabeth Azar, she's a chiropractor. She does the TMJ specialist stuff type of dry needling, and it's all so totally different, you know. I love how every healer kind of has their own flavor.
Yeah, no, it's great. There's so many things that are out there, and you know, if one thing doesn't work for somebody, there's something else to try.
Yeah, I love that.
Which is great. Believe it or not, we can needle and stim the pelvic floor.
That was my next question. You were reading my mind.
Sure can.
So tell me more about that.
So you can needle and stim the pelvic floor to decrease pain. You can needle and stim the pelvic floor to help increase strength. It's really pretty awesome. And it sounds really scary because you're needling the pelvic floor, but it really isn't.
From the inside?
From the outside in.
From the outside in. Oh, okay.
Yep,
Yeah, that's what I was thinking.
Mm-hmm.
Yeah, I've had acupuncture over that area for like the PCOS, and it really helped. And I found some supplements that really helped. But one thing I was thinking about the other day before you know, when I was running through questions to ask you for today, is I really been focusing a lot more on like the pelvic floor workouts over the last year since the yoga therapist was on here. Not just the workouts that she taught us, but I went down the rabbit hole doing the different things on like the vibration plate, the bridges, all that. And I feel like that my cramps during like my PMS cramps have gotten like almost gone. I don't think it's just one thing. Definitely the supplement was game changing
Yeah.
for inflammation, but since I feel like I've really developed those and they're back to normal strength, my cramps have not been as bad. Am I imagining that in my mind, or is that
No, and there could be a lot of things that helped with that.
obviously like what, you know, I do this kind of stuff
That's
on
exactly
it too,
right.
but I was already doing this and it needed more. Sometimes, you know, things will help, but there's always something cool and new to try that might, you know,
There
get us to
are.
100%.
So that's interesting you brought that up, because there are a lot of things, like from a pelvic physical therapy standpoint, that we can do to help with dysmenorrhea or period related pain. And visceral work, organ work, is really, really crucial for that. Mobilizing the uterus, the ovaries, the tubes, the broad ligament, uterosacral ligaments, cardinal ligaments, all of those things. But in conjunction, like looking at hormone levels with providers and looking at, does somebody need a supplement, and looking at diet. It's really pretty cool.
That's amazing. One more question, and then we're going to have to wrap it up because our next lovely art piece is here, and she doesn't want to talk to you here on the live stream. She wants to keep it top secret, and we always do. That's one question we get a lot on the live streams. Everybody knows that they're here, usually getting crazy discounts to show up, teaching us cool things. But we actually have a copy of our privacy policy. It has its own page on the website. So just because you see us here online, you know, that's one reason that we actually moved to this location. Because my landlord downstairs is an estate attorney. She does elder law. So when you walk through those doors, nobody knows. Are you here for some elder law? Are you getting your will done? Or you're getting your body snatched? No one has to know. No one has to know. So yeah, the last question I have before we get wrapped up, I'm like, oh my gosh. I'm like, just let me get this one last spot. Such a perfectionist. So hard for me to stop on the first time. Okay, so I have had many clients who, it's always somebody in Mexico. I don't know if it's if they're getting a massage in Mexico. And the lady will tell them, now this has happened both with women that I know who've had difficulties getting pregnant, or women who is like, they definitely wanted children, but it was not in the foreseeable future, like anytime soon, where they've said to them, oh, either you're having problems getting pregnant, or, you know, do you want to get pregnant in the future? And yes, and they've said that their uterus was crooked, and they've been able to, from the outside, shift it and move it, and then boom, like, they got pregnant. It's always somebody from Mexico that I've heard about it, but you know, I've never found anybody in the years I've heard about it. Is that something that pelvic floor therapists can help
So that
with?
is visceral mobilization. And
Visceral,
now
okay.
we do internal and external work. So that's, you know, my abdominal massage is external only. And a lot of times I've had lots of clients who've had my abdominal massage and not be able to get pregnant. For some it works, and for others you need both internal and external work. So it really just depends on the person.
Yeah, I've had people who've done both. And a lot of them, it's cool. A lot of them, I think that's probably how they even found out about it. They're in some kind of health or wellness field because, you know, that's why I'm so excited to have you on today, because I just think it's something more people need to know about, you know?
I do agree. It is still an area that is underserved and people don't know enough about.
Well, thank you so much for coming on today. We had so much fun. And who knows, you know, maybe we'll have her on again. I know I have like a million more questions. So now, do you have a Facebook, Instagram, if people want to follow you guys on socials, how can they do that?
Yep, it's at Restore Your Core PT.
At Restore Your Core PT. And I remember trying to find it, and I left off the PT, and I kept finding something else.
Yeah, there's a personal trainer. That's what.
And PT and personal trainers. Like, so Restore Your Core PT on Instagram. Ella Bardo 1111 for my Instagram. I do have the Ella Bardo one, but I'm locked out of it, so I cannot see anything you're saying. You can see what I post on Facebook on there still. So love you guys so much. And we'll be back to do something else a little later. I don't know what exactly. But, you know, there's always something I gotta work on. Maybe this leg or this elbow. One of those two things. Got almost all the ick out. All right, love you guys. Bye.